Okay, when people were thinking about when people were thinking about some of these strategies, the storytelling strategy, social marketing, all these various strategies for communicating our messages effectively so that we see action and internalization. So as we're thinking about doing that, in integrating this in our work a little bit, what are the barriers that would get in the way? Now, it's pretty easy to say money. We'll just assume everyone says money. But what other barriers would you be facing? And just write them down on a sticky note and share them at your table and bring them up when you're ready. And then after that, we will be looking at what are the needed resources. Where if I had this, it would really make work. Maybe if I had training in this, or maybe if I had a small grant for that. So what are the needed resources? What are the barriers? So go ahead and fill those out in sticky notes at the table, and then bring them up, and then we'll take a look at them.
Is it our barriers or whose barriers?
It's any barriers that you face as you anticipate implementing new strategies for communications. The question was asked, could you tell us more about the barriers question? Who would like to give some examples of a barrier that might be in front of you before you could implement some of these practices? Go ahead.
One was Betsy Green. One is actually the horse people in general aren't necessarily receptive to the things that they need. They want the things that they want. So I want a horse trainer, not safety or biosecurity information.
Okay, excellent. That's a great example. Any other examples that people would want to share? So it could be the target population poses particular challenges.
So mine's very in the weeds, and the barrier is very much related to needed resources, but 508 compliance is a big issue in terms of making sure that all of our web pages are accessible to everyone with disabilities. And as a scientist, I'm not trained to do graphic design, I'm not trained to do web design so that it's managed accessibly. And we don't have the resources on our communications staff to help us do that. So a lot of people at NIFA, instead of having web pages that are eye-catching and draw people in to tell stories, just have totally text-dense pages, which are not good communication tools.
That sounds frustrating. Great example of a barrier. Keep them coming, and then you'll be thinking about what are the resources you need to do that. Yeah. Okay, we can do this way too.
Yeah, I don't care.
Go ahead. We'll have one more example, and then you can write down what.
So barriers to perception of risk really is pretty low. And if they don't perceive risk, they're certainly not going to address it.
Yes. Thank you for that. Did you want to make a comment on that?
I agree. It's just this is similar. I mean, no, it's just And those perceptions of risk. I just wanted to add on that sometimes they're motivated by stories based on half-truth or bad science, and then we have to not only overcome their lack of perception, but then we have to change those perceptions that are manifested by stories that are not true.
Like the marijuana is going to make you flip out and shoot someone. Like that was early on in the trying to stop marijuana. The federal government just messed it up terribly, so no one trusted information for years after that regarding alcohol and drugs. But thank you. Yeah, percent. I'm sorry.
You mean it doesn't?
I don't know. You might have to try it. You can do that legally now. Well, this is kind of partly write down while you listen. We'll have something to put up, but also be entertained.
3 interrelated things that haven't quite come up yet, but this table talked a little bit about tradition, overcoming the barrier of tradition or norms, or apathy among the receivers.
Social norms is a major factor in a lot of this. How do you change those norms? Yeah. Continue to write while you hear these salient comments.
I think, although we had the great acronym about livestock ain't lettuce, I haven't forgotten that. But this topic is not sexy. It's never been sexy. And if we address it through fear and disease prevention, that's one way of doing it, and it's a motivator. But how do we get people to embrace the idea of enhancing innate immunity, by good management practices, things like that. So we got to build. It's sort of like we have to build a pitch for this.
Have to make it sexy.
Yeah, make it sexy. How do you make that? And actually, in the marketing world, it's how do you make the decision fun and easy? The right decision needs to be fun and easy, and that's a real challenge.
Anna Houseman, Rutgers. This is kind of a little bit of a different barrier that I think about, but when you're working with people, I think it's important to think of generational, cultural, and language differences and how you can say something and it can make total sense to you based off of your generation, the culture you grew up in, and the language that you speak, but that somebody else can hear that same information and have a totally different perception of what you just said.
That's a great framework. Generation, cultural, and language. Yes, all three of those are essential to consider when crafting messages. That's why you do the focus groups, not with the target population. That's why you try to find the population so you can test those messages with them. All right, so the highly anticipated report outs by our professional analysts are coming very soon. Who's ready? And the spokesperson for barriers. Who's ready to listen to the themes that come out of barriers? Yeah, clap once if you can hear 10. Clap once if you can hear 10. Woo! 3 times. First, our first analyst, Chris.
All right,
Listen up,
Give it up for Chris Humming. That's so exciting. Okay, so our sticky notes wouldn't stick together, so we decided to just write the themes on there rather than piles of paper on the ground. So time for the individuals to create these things. We have lots of things on our plate, so time is hard. Overcoming cultural norms, generational norms, and language barriers. Those were all barriers. How much bad information, inconsistent advice, and inconsistent messaging already exists. So you have a barrier to overcome how much is already out there that's in the wrong direction. Our stakeholders don't understand the risk or are extremely apathetic about the topic. We don't know how to produce a lot of these materials in these fancy, fun formats for consumers to take in, nor do we have the money. Tradition says, we've already done it this way, nothing's happened to me, nothing happened to my grandpa, why should I ever change? Administration may not be supportive of individuals doing that work. We may lack credibility or trust from the stakeholder, so why should they listen to us or government that's coming in to make their lives worse? So the audience not receptive is probably a lot of that. And then another theme that we saw a couple times is that if this is successful, something doesn't happen, and that's not exciting for some. Your results are nothing. So that's the common themes that everybody said.
Okay, very good. Thank you very much, Chris. Okay.
All right. Squeeze
Who
sort
is
of.
on your team?
Gabriella is on my team. And we sort of put things into 3 categories, or sort of resources, money, and personnel.
Jeanette, can you speak right into that microphone?
Okay, resources, money, and personnel. So time and money to produce it, barriers, time constraints, need to dedicated personnel, expertise, recognition that when grants are expected or required, the successful grants displace the home responsibilities. So so that you're changing your focus all the time depending on the grants. Access to veterinary services. So that's sort of the time and money part. And then we sort of did the interpersonal and communication part, collaboration, stories. Somebody said key contacts and change agent, early adopters in each community. So you can get to those early adopters. Stories, cultural studies, which becomes part of the story. Interdisciplinary collaboration. And the story database seemed like a needed resource. And then the other was more to do with the messages and how we put the messages out, and public system to translate technical info to accessible and action-ready material. And need applies to biosecurity, animal welfare, food safety, all those. Accessibility, not sexy. We need to make it sexy. And someone suggests maybe we look at how did they get, with all the STDs and all that, how did they get that to be something you could. STDs themselves aren't sexy, and the use of condoms is definitely not considered sexy. But getting those messages out, and maybe there's some lessons to be learned there. How can we make biosecurity and wearing the PPE stuff and all that, how can that be sexy?
All right.
Or cool? So.
Excellent. Thank you very much. All right. There was a notorious marketing buzz around stopping STDs in Burlington about 15 years ago, and it was a really rainy summer, and everyone was walking around wearing rubber boots. So the whole pitch was, don't forget your rubbers. And it actually was amazing because people really spread, that word is everywhere.
Spread the word, not.
Yeah. Here's hoping. Okay, well, this conversation will continue in terms of how do you overcome some of these barriers, and also how do you access some of the resources that you need. It's always like it's a challenging situation to be in a full-time job and have really usually like a job and a half worth of job. So how do you expand your capacity in some way? When I was doing the Robar program, I had about 10 interns helping me out with different things. And I actually now, that's my day job is placing interns. And I place about 100 a year at UVM. So that's one. Capacity is not only funding, so it can be human or technical or other. So it's worth thinking about. I also did a crowdfunding campaign when I was doing Robar. So I raised $23,000 on a Indiegogo site. Produced a video for that. If anyone wants to see it at some point, I have it. But so it's how to be creative and not work yourself to death. Right. So.